Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. This week, October 4th to 8th, 2021, is Digital Inclusion Week. In this episode of the podcast, we take a closer look at digital inequities and exclusion, their particular impact during the COVID-19 pandemic, and the role community health centres plays in tackling them at the community level. I speak with the staff at Somerset West Community Health Centre in Ottawa to learn about their innovative work in this area. Somerset West Community Health Centre provides a wide range of health and social services geared to the diverse needs of individuals, families, and groups in Canada's capital. You can learn more about the CHC and their specific geographical service area in Ottawa by visiting their website at www.swchc.on.ca. Today, I'm speaking with Sue Merrill, Somerset West CHC's Manager of Planning, Evaluation, and Quality Improvement. Hey, Sue, how are you today?
I'm well. How are you, Hilary?
Great. First off, can you tell me a little bit more about Somerset West Community Health Centre, the client base that they serve, the services and programs that you provide?
Sure. So Somerset West is located in the heart of Chinatown in urban Ottawa. We also are very close to Little Italy, and so it's a very diverse, culturally diverse area. It's also an area where there's been increasingly unaffordable housing due to gentrification, which has led to a much larger homeless population. We also learned that we have a large population of people who use drugs through some health data that showed many years ago that we had a very high rate of overdose. So as a result, we've really scaled up our harm reduction programs and services in the last several years, including a supervised consumption and treatment service. But we also have culturally affirming and linguistically adapted services for the many different communities, including the Chinese, Cambodian, Vietnamese communities for many, many years, and also the African, Caribbean, and Black community. We also have a newcomer health center, and so we do a lot of work with refugees and newcomers. And like all CHCs, we work with the span of ages. We have Head Start nursery schools and after-school programs and youth. We work a lot with isolated seniors. And we really do focus on those who are made vulnerable by systemic barriers and lack access to the social determinants of health because of these barriers.
That's amazing. We know that digital inequities and digital exclusion predates the pandemic, and we will get into how the pandemic intensified those issues in a minute. But for our listeners who might not be familiar with the idea of digital inequities, can you explain some of the concepts and what we're really talking about when we say digital inequity and digital exclusion?
Sure. I mean, I think we've come to see that there's two key areas that leave people excluded from digital life. One is lack of access to the devices, to internet, to bandwidth. For some people, those who are precariously housed or homeless, even electricity to charge a phone. So lack of access to devices is a huge one. The other thing we talk about is the lack of meaningful adoption. So if people can't use the platforms, they're changing all the time. You have to have a certain degree of knowledge, comfort to use and change and adapt to different technologies. Then even if you had a device, you might not be able to use it to participate in accessing a service or taking part in an online group. So think of all of us who had to learn how to use Zoom all of a sudden during the pandemic. That took a lot of learning, and that's for a lot of us who are pretty used to using technical tools and equipment. But if you're a senior who lives alone, who doesn't speak English or French, can you imagine trying to access your doctor through a visual platform? It's very, even if you had access. So we find access to devices and adoption are huge areas of that lead to inequity.
We know that digital inequities and exclusion are linked to a variety of factors, as you've just said, and these challenges were already there before the pandemic. Can you tell us what things looked like for the client base that you served as the pandemic took hold, what their experiences of digital inequity looked like, and what digital equity efforts specifically Somerset West Community Health Centre implemented in response to the pandemic?
Certainly, yeah. So definitely these factors were were existing before, but they didn't create as much of a problem because so many of our services and supports as a community health center were low barrier. They were in person. We tried to make a transportation available. We tried to make language available. We try to do everything we can to remove barriers for people to access services. And we've become masters at doing that when in-person delivery. But once there was a lockdown and there were only essential services allowed to be delivered in person, many of our other services, which we do consider quite essential, we had to shift to virtual. So that suddenly made this a game changer, because now we have isolated folks who rely on a caseworker or want to see a doctor, or who used to take part in social groups. They can't take part in any of it. So we had to adapt in a bunch of ways. The first way is we had to figure out as a staff team how to deliver those services, how to pivot and offer them virtually, either by phone or by Zoom or by whatever we had to learn those platforms. We even had digital inequities amongst our staff teams. We have lots of people from different communities with different levels of knowledge and skills. So we had to do a lot of internal capacity building. But once we were able to offer things, which we were able to do quite quickly, it was very clear that many of the clients couldn't, because of those two other issues: lack of access to a device or internet or data, and or lack of understanding of the technology. So that's where we were able to get some funding from a few funders, from TELUS, from United Way of Eastern Ottawa, and from the Ontario Trillium Foundation. And as a result, we were able to put together a digital equity support team that could support staff and clients with these issues. So that's in a nutshell. And as a result, we were able to, we lent out or distributed over 225 devices, ranging from flip phones, smartphones, tablets, Chromebooks. And in some cases, we did things like, some people just wanted a projector to see things bigger. Some people sometimes had a phone, but they couldn't use it, so we looked at a tablet. We also explored a variety of platforms, because even with access to tablets, we found for some seniors, especially those who are quite isolated without younger family members to support them, learning a new platform like Zoom was very daunting. And so we discovered low barrier phone conference software called Mercury that is used by other programs such as Senior Centers Without Walls. This allows someone to join a group on a phone without having to do anything. We can even call them. All they have to do is pick up a landline and they are part of the call. And that has been a game changer as well. So we've been experimenting with different things that work for different groups and being able to offer a range of things virtually. And I think it was very successful, but it was an incredible amount of work and very complex. We also couldn't have done this with a lot of key partnerships. So for example, we reached out to Connected Canadians, who helped us link up with some devices and support early on to seniors. We also worked very closely with the Virtual Care Project of the Champlain Mental Health and Addiction Task Force, and they helped us with procurement of devices and with some of the policies and protocols around device lending. So all of these partnerships really contributed to us being able to do what we did as quickly as we did and as effectively as we did.
While we are at a better place now in the pandemic than we were a year ago, it's not clear that a lot of systemic issues affecting the clients CHCs serve have gotten a lot better. What are your thoughts in terms of ongoing issues related to digital inequities among the clients you serve at Somerset West Community Health Centre? And what are some of the system level responses that we need to see?
Yeah, that's a great question. I think as CHCs, we're often at the front line of responding to an urgent unmet need in the moment, but we also know those are tied to systemic issues that ideally would be eliminated, so we wouldn't have to be giving out devices or paying for people's data. So I think what we've all seen is that really access to broadband, internet, and or data, and access to devices, whether they be in shared hubs or in community settings, has to be available for people. We'll never be able to provide everyone who needs one with a device and access to internet. That's a systemic issue that I think is a collective impact type of initiative. So I know that we are part of a local collective impact approach that's being run by the Social Planning Council of Ottawa and Capital Freenet to look at those issues that are more about broadband and how do we help broadband become more accessible and affordable for more people, and look at spots where people could access devices. We're also in touch with our our organization, the Alliance for Healthier Communities in Ontario, which have made a playbook and are doing a lot of advocacy and system level response, so that we can all be working as we do in community health centers at the frontline level with individual clients, with communities, and to influence systems to try to make access better and equity better.
What do you think your experience over the last 18 months says about the ability of community health centers to adapt to emerging social and public health issues and the importance of CHCs within our health and social service systems?
Well, what I saw, not only from our organization, but from many of the others in Ottawa and across the sector, is that we are incredibly well positioned to pivot and adapt quickly. Some larger organizations were required to close and had a lot of restrictions on their ability to change, or it took them a long time. We never closed, we never shut our doors. We immediately figured out who needed to continue in-person services that would be life-saving, and we also switched to virtual right away. So we were able to turn on a dime, and we had to do that all with no additional resources. And it meant staff had to change completely how they delivered services and reached clients. So we found ourselves doing a lot more in the area of digital equity, which we hadn't been highly involved in before. Same thing, although we'd always played a role in food security, we got way more involved in our food security partnerships for the same reasons, because we have the relationships with the clients on the ground who are often the most isolated, and we see the direct needs, especially in an emergent crisis like COVID. The needs changed and were urgent. And so we were able to connect people to the things they needed, and where those supports didn't exist through partners, we jumped in to create them. And that's why we got into the digital equity space, because there was no other group or organization who could provide those supports at the time.
I think the work you guys are doing at Somerset West is amazing. So Sue, thank you so much for speaking with me today. As I've said, you can learn more about Somerset West at www.swchc.on.ca. Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.